Now let's take a closer look at the Omicron outbreak with Dr. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Good morning. How are you doing?
Good morning. Fine, thank you.
Now, the COVID cases, the numbers are rising. Should we be worried?
Well, of course we should be worried, as we have for the past 2 years. What we're seeing right now, though, is a very different part of the pandemic than we've seen in those past 2 years. And that is with Omicron, we are going to see a viral blizzard over the next 5 to 8 weeks in this country. We're already beginning to see these very large numbers you're talking about. They're going to increase substantially. The true question we have is how many of those will then actually become severe illnesses requiring hospitalizations and even deaths? And that's the challenge we're at right now. We don't yet we don't understand that.
Now, as we heard in Nikki Batista's piece, many people are reconsidering their New Year's celebration. So what advice do you give to individuals out there that say, you know what, I still want to party and have a good time as I bring in the new year?
Well, first of all, we have to be really clear and say that if you're already vaccinated and you have that third dose, some call a booster, I like to think it's part of the whole 3 dose, you really have a much, much higher level of protection against becoming infected, seriously ill, or in fact dying. But you still have a risk of becoming infected. And so to avoid that and becoming infected and potentially transmitting that virus into others, yes, avoiding these large crowds are really important. If you're someone who has not been fully vaccinated, if you're someone who has an underlying immune compromised condition or puts you at risk for serious illness, the last thing you want to do is expose yourself to this virus. It's so highly infectious. So I think while people are really frustrated, they are tired, we all know what has happened to us over the last 2 years. This thrust with Omicron over the next 6 to 8 weeks is so significant. Please, just let's get us through this one. And then I think we're going to see a light at the end of the tunnel through the rest of the year.
Yeah, we hope so. I want to touch on the CDC guidelines in a second, but you mentioned boosters. So, we're hearing from Johnson & Johnson this morning, and they're saying that their booster, it will protect you up to 85% effective when it comes to the Omicron variant. What do you say about this news that will be coming out?
Well, I think it's very important news. We all look forward to the release of the full data later this morning to look at that. But I think the point to make is that Omicron in of itself doesn't overtake the vaccines, meaning that if you're vaccinated, that you have protection. The problem we have, though, is this surge is going to occur in the next 3 to 8 weeks. And it takes at least 14 days just from the time you've had that third dose, or with the J&J, that second dose, before you see increased protection. So you can only count on these vaccines working if you already are there. You can't suddenly play catch up right now. Still get vaccinated. We've got a long year ahead of us, but at the same time know that you're going to have to protect yourself in the absence of vaccine if you haven't been vaccinated yet, because it just takes that much time for your body's immune system to respond.
Yeah, when we protect ourselves, we protect others. The CDC, they are getting a lot of pushback for their new guidelines. Should there be antigen testing along with this, new isolation guideline?
Well, first of all, I very much support the CDC activity. I have to say that this was not something that was motivated by just an economic issue. Over the course of these next 6 to 8 weeks, as I've been talking about, we're going to see an unprecedented situation in this country where many, many people will become infected. We're already seeing healthcare systems that are already stretched to deal with cases before Omicron came along, now potentially losing 10 or 20% of their workers. Critical infrastructure, losing 20% or more of their workers. And what these guidelines were really all about is how can we maximize, and this very imperfect situation with an imperfect solution, to say, you know what, most of the transmission is going to occur at this time period. By the 5th or 6th day, we need you back into that workforce area, not for money, for the very sake of trying to keep life moving forward. Yeah. And so I think that this is really an important activity they're taking on. I wish it was better. I wish they had more masking data, et cetera. But at this point, I support what they're doing.
Dr. Osterholm, thank you so much, helping us navigate through the new year and, of course, COVID. Have a good one.
Thank you.